Welcome back to this week's episode of Promising Young Surgeon. I'm your host, Dr. Frances Mei Hardin, and today I have the enormous privilege of speaking with Dr. Dominick DeFelice, a fellow physician and writer. Dr. DeFelice's journey is a testament to resilience and the complexities of navigating grief while in the demanding world of medical training. So not only are we both practicing physicians and writers, but we really connected on this third component of our lives and our really medical training experiences, which is that grief component. And it's not fun. It's obviously a much more serious topic that we're going to be getting our teeth into today, but I do think incredibly important. And I'm grateful to be able to talk about all this with a very thoughtful, wonderful person. So join us today as we're going to be exploring the singular experience of experiencing grief and loss in medical training. To introduce our guest, Dr. Dominick DeFelice is a family medicine and sports medicine physician who practices in the coastal city of Wilmington, North Carolina. He works in a family medicine residency clinic, on inpatient wards, on the sideline, and ringside with USA Boxing. He also serves as a mentor for medical students and residents. Outside of the office, Dominick is a huge baseball fan and aspires to visit all 30 Major League Baseball stadiums. Though he considers himself an amateur, Dominick loves writing science fiction and fantasy, and he is working on publishing his third novel. He has co-written a sci-fi trilogy with his grandmother. Dominick, welcome to Promising Young Surgeon.
Thank you so much for having me on. Thanks for the kind words. I'm really happy to be here.
It has just genuinely, again, I'm going to fangirl a little bit. Of course, I fangirl over a lot of the incredible guests that we have on the show, but I met Dominick where, a mutual friend introduced us, and the one-liner, the intro was, I know a physician, and he has published a few books that he co-wrote with his grandmother. And I put down what I was doing. I was like, I'm in, I'm sold. I want to meet this guy, and what has been really cool, just to kind of introduce for everyone, I did grow up with both of my parents and my two grandmothers, maternal and paternal. And so I'd love if you could kind of share with us too. I know we both bonded over the unique gift of getting to grow up with your grandmother.
Yeah, exactly. So in my house growing up, it was me, mother, father, my younger sister, and then my mom's mom, my grandma Velma. And she moved into the house when I was 2 years old. So she's been kind of a third parent from basically day one. And it's been really cool to meet someone else who had something similar happen.
I love that. Yeah, I think similarly, my grandma and grandfather at the time, the paternal ones, they had moved in around that age. And then, my maternal grandmother, she was with us from 0 on. And so I do think that that's really special. And I love, I very sadly did lose both my grandmas since then, which is something that, I want us to kind of discuss today. But I think that it's incredible that you are still so close with your grandmother. You guys are co-writing together. That's no small feat. That's not, quote unquote, just staying close with a family member. That's a co-writer and a business partner, essentially.
It's been wonderful. I've been lucky enough to still actually have both of my grandmothers. They're both 94, born the same year, both born in New York City. And I still talk to them and have fun times with them all of the time. And it's just really, really nice.
You are going to live forever, probably, on those actuarial tables.
I hope so. We have a little Mediterranean in our genes, so that's kind of one of those blue zones. So I'm knocking on wood. I hope so.
That's incredible. Well, I know that there is so much about your career that I really like. I love. I want everyone to kind of be introduced to some of what you do on a daily basis. You get to touch on so many cool things in terms of keeping the medical education component of it, the USA Boxing ringside, physician experience. Can you walk us through what your career looks like now, and again, just some of those decisions to kind of create the career that you currently have and that you very deliberately built for yourself?
For sure. So my current role now is primarily as a faculty physician in a family medicine residency. We said down here in Wilmington, North Carolina, which is out by the coast, very nice kind of beachy town. But as like most family medicine docs do, I kind of do a little bit of everything. So I work with residents in the office setting as they're seeing patients, as they're doing procedures on patients, as they're doing things like prenatal visits or well child checks for kids. I see patients myself, a couple half days a week. I'm doing kind of broad general family medicine in the office. I do 1/2 day a week of dedicated sports medicine clinic where I'm seeing patients for musculoskeletal issues. 1 week, about every 6 weeks, I'm on our inpatient service, kind of run by the residents. One from each year. Family medicine's 3 years, so we have a PGY 1, 2, and 3 kind of running that service, and then I just kind of supervise. And then really, those are all passions of mine, all those practice settings, but I also do a lot outside of work. So you mentioned the boxing. It's funny, I actually covered a whole 3-day weekend boxing thing about an hour from here, Friday, Saturday, Sunday that just passed, and saw maybe 100 or so boxers over the course of the 3 days doing pre-fight physicals, being ringside as they're, doing their bouts. And then every boxer also gets a post-fight physical. So it's a lot of fun. It's busy. It's a lot of fun though. Some other kind of snippets of things I do, healthcare advocacy, just something we can touch on maybe at some point if we want, but lobbying politicians for the needs of family medicine docs and patients. So I realized I kind of word vomited. That was a lot of stuff. But there's just so many kind of different things myself and my partners in the faculty group all have our kind of, hands on.
No, I love that. And I think that that's a very wonderful, poignant snapshot into your life at this point in your career. In contrast, I'm out here, I'm just in an unusually chipper mood today because I'm coming off of 10 straight days of call. So,
oh, goodness.
Like
my hat's off to you.
Just like a slight extra pep in my step, which is still not that much pep, but like a little bit, because I'm happy to be done with that. But and that's so cool. I mean, it makes perfect sense, but I had never thought about like pre and post physicals on these athletes, just because in other sports those guys don't all get pre-post game physicals, I assume. But that's interesting.
Yeah, it's so it's all kind of through USA Boxing, which has very specific regulations, and that's the same organization that's sending athletes to the Olympics. I mean, that's like the USA Boxing. So these folks have to meet certain protocols every time they want to fight in one of these USA Boxing sanctioned events, and they might wake up the day of their fight and have the flu, for example. So we have to always, every single athlete, every single fight, make sure it's safe for them to go into the ring because the stakes are quite high. And then, of course, after they fight, there's the possibility they sustain some kind of injury. So you can imagine, we have to do a quick check kind of head to toe, ask them if they have pain anywhere, see if they have any other injuries that way. So it sounds like a lot, and it is a lot, but it's certainly one of the more fun things I do. I love going to these kinds of things. So it's just a lot of fun.
No, that is genuinely so cool. And of course, I do facial trauma, mostly non-operative type of stuff. But of course, I'm thinking of like the nasal fractures. I mean, have you seen things like a septal hematoma?
Totally. Yeah. So it happens not frequently. I mean, most of the fights I cover are the younger age ranges where the forces of the punches aren't on average as high as some of the older kids and adults. So not as many things like concussions, facial traumas, but I've definitely seen one or two where I couldn't fully be confident they didn't have an orbital fracture or maybe a zygomatic arc fracture or something. So I've had to send one or two to the ED for kind of, CAT scan, maybe a consultation with an ENT, that kind of thing. So it does happen.
Wow. Yeah, it's so interesting because, for our listeners, or if you guys haven't seen septal hematomas, the reason I ask about that specifically is because, it's definitely like it's high yield. It's a test question. It's one of those you can't miss type of diagnoses just because, well, I mean, it's painful, but also a complication of an untreated septal hematoma is where you're going to have just a permanent septal perforation, the cartilage necroses and just kind of resorbs. And so now you have a hole in your septum just permanently. So we think of septal hematomas, but what's funny is even though it's like this, high yield, like it comes up a lot in conversation and maybe in test questions and things like that. But fascinating because I personally have still not seen that many in my career. I'm sure that there are young ENTs out there where Dominick has seen more septal hematomas than they have because, you're where the action happens. You're just seeing like maybe a lot of contact to the face over and over again traumatically. So that's pretty cool.
It's really cool. And I'll say too, I sort of neglected to address the septal hematoma point in your question. We, every year USA Boxing throws a conference for folks who want to do this, docs who want to cover ringside. And I remember I did it a year and a half ago or so. And I remember getting a lecture from an ENT who covers boxing. And he said, nasal fractures plus or minus septal hematoma. If they have one, he's like, you really have two injuries on your hand. You have a broken bone and you have a soft tissue problem. And he's like, you've got to address both. So he went through how he drains these ringside and packs them and does all these strange things. And I was just kind of like, friend, if I see one, I'm pretty much sending that one. But it was funny. Yeah.
Wow. I don't envy the people who get those hematomas drained ringside and get their like noses packed. Yeah. I just like that gives me like goosebumps thinking about how painful that would be. But, I appreciate you talking us through that. And like I said, and like you even mentioned, you do a lot of healthcare advocacy and lobbying. Like there's just a lot of really meaningful things that I think we can talk about and can connect on. But I do want to focus on, the grief and loss aspect of it today. But before we even got into that, I actually think that this conversation is really important because I want everyone to see, what it looks like, of course, in your daily life now and what thriving in many ways really looks like. Because we don't want to just be doom and gloom, but unfortunately dealing with these very real aspects of being a human, grief and loss like that. Sadly, that does not, you're not protected from that as a medical trainee or just because you're like, well, I'm going to be a doctor. And then you get spared these very human, devastating types of experiences. So if it's okay with you, would you mind sharing with us your story?
Of course. Yeah. I'll just kind of start and tell it kind of as it happened to me. It's a little bit long, so bear with me. So this is kind of set the stage a little bit. I'm from North Carolina. I was raised here, did medical school here, and then in 2018, transitioned to doing residency and sports med fellowship up in New York. And again, that nuclear family that I mentioned of me, my sister, my mom, my dad, and my maternal grandma, all kind of based in North Carolina. So I left that for a little bit to do my residency and fellowship. My sister, at the time that most of this happens, was actually in Minnesota in speech and language pathology school. So the story kind of starts in fall of 2022. I was in my sports medicine fellowship year. I had started that past July of that year. It was about mid-November, and I was actually on vacation, and I was flying from where I was in Western New York, upstate New York, to Calgary in Canada. Me and my partner at the time were flying out to have a vacation. And it's just the first kind of thing I remember, the first like inclination that something was wrong, something was off, was I remember landing in Canada and like, that thing where like your plane gets kind of close to the ground and you start getting some signal back and some of your messages and stuff start coming through. I just remember like dozens of text messages and missed calls and like voicemails had all been left on my phone. It was like a 3-hour flight, and somewhere in there had just gotten all of this stuff. So we land. I start looking through what was going on, and I see a bunch of stuff from my dad and my sister. And I see, like, I'm sifting through, and I see from my sister, like, hey, you have to call me. Like, something happened with mom. So this will be a story about how I lost my mom. So I'm like, oh, dang. She wasn't the healthiest person. She'd been to the hospital a couple of times. So I kind of text her back. We're still like in the plane. We haven't even deboarded yet. I just say, oh, hey, what happened? She calls me within 2 seconds of me sending that. And she basically explains to me, and again, she's in Minnesota, so everything she heard was kind of secondhand. She just says, I don't know, something bad happened with mom. Dad's been trying to call me and he's not really like able to speak right now. I don't know what's going on. There's like ambulances there and the neighbors are there. I don't really know what's happening. So my temperature's elevated, my heart rate's elevated. I'm starting to freak out, right? We get off the plane. I can't just like, leave the airport, make a phone call. I got to go through the customs stuff. So I'm like, I've got my like voicemails, like my dad's still like trying to, like everything's going on my phone, everything's blowing up. And I get through customs finally in that whole line and all that stuff and immigration. And then I finally have like a smidgen of time where I can call my dad and see what's going on. I call him and our next door neighbor answers his phone and says, you need to come home. I hate to be the one telling you this. Your mom has passed away. And I just, that like everything goes black. Like, what did I just hear kind of thing. So over the next, 5 or 10 minutes, I have calls with my sister and my dad. And I kind of figure out that she, something happened while my dad was, out kind of running errands. He comes back, he finds her like in bed, unresponsive, everyone gets called and she comes and she was deceased. So everything's scrambling. I'm trying to figure out what happened. I'm trying to figure out how she passed away. I don't know necessarily any details. So I immediately buy a ticket to go from there to my home in North Carolina. My sister buys a ticket to go to North Carolina. And I just remember like the next flight home was like 12 hours later. So I'm in Alberta, Canada, and have to like find something to do for 12 hours until I can get back. And me and my partner at the time had all these plans. We were like booked for all this and that. And obviously, that's out the window. So we're just like hanging kind of around the airport. And then eventually 12 hours is up. I fly home. I get back and I find out that, there was no readily identifiable, details about what happened, but they found a bunch of kind of pill bottles around her. She was on a handful of medications and I was able to see like the report from the EMS. They were nice enough to like give my dad a copy, I guess, because he wasn't really like able to, talk through details or like make any kind of plans or anything like that. So me and my sister read through that. And he was also given a sheriff officer's card that we could call and have details, and the card for a funeral home. So yeah, my sisters start, like making calls and trying to figure out what's happening. And to flash forward a little bit, I eventually learned that she did take her own life. She did intentionally overdose on one of her medications. And we, to this day, have not found any kind of note or explanation. And it's something that me, my dad, my sister, and then her mom as well, my maternal grandma, lost a child that day. It's something we, as a group of four, had been just kind of, it's been 2 years. We've been kind of processing it on an ongoing basis ever since. We still don't have a lot of answers. The investigation is closed and there's no real other details coming out. And we do our best to kind of, honor her and move on. But that's sort of like the timeline and the facts of what happened. The other parts of it that I think are relevant are like this happened smack dab in like my last year of training. I'm someone who was lucky enough to kind of go straight through everything. I tell people I went straight from kindergarten all the way through fellowship, didn't skip anything or do anything in between. And this was like 6 months to go. I had this, horrible thing happen with my mom and my family. And it was tough for just so many reasons, right? I mean, I just lost my mom in a very traumatic way. I was, I sort of became like the de facto leader of the family, kind of, socially, financially. But I also, I realized my mom would have wanted me to finish my training. So I also had to kind of find a way to fight back from this and get back up to New York and kind of do my last 6 months. So that's maybe where I'll kind of pause for now. It was, there was a lot, but that's sort of the stage, and then the things that I was wrestling with, being in my training during those events.
Sometimes there are no words, but I'm so sorry for what you went through and what your family members, of course, all went through with the loss of your mother. And I really, like in terms of hearing this story, that you're sharing for the first time with me, I can identify with the loss of a parent suddenly, but, and that's it, and everyone's grief is so different. I do think that people who maybe know grief and people who have lost a parent, we're in a club that nobody wants to be in, no matter how old you are at the time of joining that club. But I'm just very moved by your vulnerability and honesty, like in sharing the story and the facts. And I really like we haven't even gotten into, it can't be overstated that you have 6 months of training left. Like training is kind of not a walk in the park to begin with. And then to deal with loss, I don't know where you found the strength to just like complete your training, but that's what we're here to talk about today. So I'll turn it back over to you for that.
Yeah, I want to thank you kind of to start. I want to thank you for, having me on to have a platform to share this story. It's actually something I haven't shared with very many people, kind of that level of detail with, but I do want it to be in this arena on this podcast, because I think it's something that I can't be the only one that, has lost someone so close to me and have it happen during a really sensitive time, like medical school or training, or maybe even, the first little bit out of training. I mean, that's just such a, I think, vulnerable time in people's careers. Those are kind of the foundational years. So I want to be a proponent of, the people who are willing and able to talk more openly about it. What I'll say in terms of where things went after she had passed with my training specifically, the other kind of interesting side of it was that my sister also had just 6 months left. She was going to graduate SLP school within the same month or two that I was going to graduate fellowship. And she had, of course, been through, high school, undergrad. She had volunteered for a number of years with Teach for America, and then she was at the tail end of her 3 years of a master's program for SLP. So what I remember some of those conversations looking like early on were, me, dad, and my sister and my grandma were all in North Carolina in the immediate aftermath kind of processing things. I'm older than her by 2 years. I put on my big brother hat and I said, I'll handle everything here. You go back to school. You graduate on time. I'll handle, the estate stuff. I'll handle the financial stuff. I'll handle everything with, getting names off of things and into like my dad's name, all the just sort of, financial and kind of technical fallout. I was like, I don't want you to worry about any of that. You go back, you finish your schooling. Then I remember having a really long but really nice conversation with my fellowship program director. That was kind of my next step after I, talked with my sister.
And may I ask, is this like a phone call? You're in North Carolina in this scenario, right? So this is a phone call to the program?
Thank you. Yes, that's exactly right. So this is maybe in the days or maybe up to a week or so after my mom passed. My program director had gotten word from me about, what happened. And he said, don't worry about a thing back here. We'll put everything on hold. You just text me or call me or email me when you're ready to, reach out and we can talk next steps. No pressure. Very, very nice gentleman. So I remember calling him and just saying, this is kind of what happens. There's a lot of stuff down here that needs to get sorted. And I don't know how much time I need, but I know I'm going to need some more time. And he, very accommodating, said kind of whatever you need. And it ended up that I ended up taking like 3 months off of fellowship. And I'll say that's not typical, obviously. One, to have to do that. And then two, to have a program that gives you the grace to do that. Fellowship's a little different than residency. It can be harder to extend a fellowship than a residency. Just with, timing of rotations and sportsmen specifically, you're working around the sports calendar too with your college that you're following and those sorts of things. So at the end of the day, I was really lucky to get 3 months, but that 3 months I remember being just really, really tough. I mean, I was hitting the therapy, the online Zoom therapy pretty hard. I was in and out of like a zillion phone calls and meetings with lawyers and the sheriff at the time who was taking things up. And everything just was kind of a huge tornado. But I was lucky enough to have it. My program was accommodating enough to let me have it. And I did end up graduating my fellowship 3 months late. So I ended up finishing instead of the typical like July 1. I ended up finishing sometime in September or October. And I remember one of the tougher parts was, leaving North Carolina and going back to New York. Like I remember like physically not wanting to leave. I was like, my sister was already back in Minnesota. I was like, I don't want to leave my dad and grandma down there. Like I just remember wanting to be around my dad as much as possible. So it was really tough to go back to training in in kind of every sense of the way there. Yeah.
I cannot imagine. I mean, I like, you got to give me, like, I hope the listeners give me grace, because I feel like, especially, and we know this, I mean, I've made this point before, but like sometimes when we talk about like these huge challenges, or like when the emotion brain takes over, it can be like there can be cognitive articulation difficulties with that. So, and sometimes I experience that. So that's a little bit of how I feel now. But um, I mean, like, I can't applaud you enough. Applaud seems like such a crazy word to use for it, but I mean, like, putting on the big brother hat. That's incredible how you stepped up for your family and your loved ones. Like, I think that's incredible. I think the fact that you went back to training at all is incredible. And again, I mean, I know that we started almost at the end when we started talking today, but it's like, I mean, you have such a beautiful and rich and meaningful life. So I think that's quadruply remarkable in the face of everything that it took to get here. I do feel like, in terms of concrete things where we're always trying to figure out, like, how can we help others who may experience anything even remotely like this, or need to take a sabbatical, from training, whether it's, I mean, medical school, residency, fellowship. I guess some of my questions, because like you alluded to, it's not like a guaranteed that people could take a sabbatical from fellowship, especially not like for 3 months. And so, was there any magic to that? Is it just truly at the will of the fellowship director? Are there ways that, like, the ACGME has, like, carve out provisions for that type of thing? Like, what could someone do who feels like they need that time?
Yeah, I think that's a really astute question. I'm realizing I'm having some of that emotion brain too, so some of this comes out garbled. I apologize, but I would say some of the tips and tricks I learned along the way. I went through the FMLA process to do mine, and so there's kind of two considerations. One, what will your program and your institution and your program director kind of allow you to do? And then number two, how do you actually, like, mechanistically get that time off and, transition back into your job as like an employee? So I would say I don't know that I can speak in general about kind of fellowships across the board and their leave processes. But I will say my program was ACGME accredited, and I know there are certain built-in protectors for ACGME residents and fellows with things like family leave. So I was able to do all of mine through FMLA and work it out with my program that I could stay a little extra time and just knock out the last, like, kind of clinical and administrative requirements in that time. The process for FMLA was a little tough because usually that's like a personal injury. Like if you have surgery or you got sick, we're in the hospital for a period of time. I actually had to go back and forth with my institution a number of times to get it approved. But what I basically ended up doing was I went with my dad to a visit with his primary care doc and got that really nice and accommodating family doc to sign off on basically, like, I'm supplying my dad, like medical care, but psychological care as well during a period of grief. And that's what ultimately my, like, disability folks and my institution accepted, because I couldn't go to my doctor and say I was having any kind of physical injury. I wasn't even in the same town as my doctor. So it was really difficult for me to do anything for myself. I suppose I could have done it through maybe a mental health leave, but I just didn't have the resources or like the capability to visit with someone and have that person sign off on papers for me. So I basically told my institution that I needed 3 months to take care of my dad, um, which was factually correct. I mean, we were kind of all going through it at the same time, and he needed a lot of help kind of around the house and with finances and planning. So I would say for folks who have experience a loss in training and have to go through this process, you always want to think about those kind of two buckets, like what will your program and your program director allow? And then how do you actually get the time off approved and still, get what you earn, which is some disability income and a path back kind of through your employer.
Yeah, that's very helpful though, because I hadn't thought of that, and like naturally, I feel like my mind went to, you know, I feel like I would try maybe acute stress disorder or something like that for me or a bereaving person. There's sometimes like bereavement leave, but that definitely makes sense. And yes, of course, some elements of that unique to your family structure and your situation, but caretaking for a family member, a survivor in this case, I think that that's helpful because part of it too is that when you're a resident or even a fellow, like most of us are adults by that time, but we don't have a lot of experience with some of these real world things. And then, like I mentioned, when you're going through a difficult time like this, well, guess what? That's probably going to be some of the like lower creativity juices and like troubleshooting. I mean, that's really hard. That's a lot to ask like any grieving child to do, is to be like, well, get creative. Like, that's crazy. Did your paperwork not go through like 3 times? Just, well, keep putting your nose to the grindstone. It's like, I think that what you shared is very helpful. Um,
Yeah,
and
I would just interject and say it's probably, more typical for someone to get that leave granted because of some type of bereavement or, acute mood disturbance or something like that. And those were the first things I tried, and it got declined because I didn't have supporting documentation. And again, that's because I think I was, geographically just very far away from all of my docs and therapists and stuff. So it just wasn't working.
Of course. But I mean, but that's the thing is that to me is like part of the problem and part of the whole, because like I will tell you, I mean, I had a doctor of any kind for very inconsistent parts of residency training. Even for most of medical school. Like, I mean, I received some medical care kind of really, really as needed, and thankfully I was pretty healthy. So like a lot of us, especially, I was not in my home state even for medical school training or residency, or attending job. And so like a lot of the healthcare is fragmented. um I didn't always feel like, oh, if I needed a note from a doctor or even like a script from the doctor, my old doctor in the previous state isn't refilling this anymore. Like a lot of us are not good about, and I'm just speaking for myself and a lot of people I know, like we aren't even good about just continuity of care, let alone in your situation. Now you're finding yourself out of state. So it's like, I get it. Cause even if you did everything right and got like routine recommended care, now you're marooned physically elsewhere. Is that fair?
Completely true. Yeah. I mean, if you talk about the fragmented healthcare system, there's a quote, I'm not going to remember who it's attributed to, but our healthcare system isn't about health. It's not caring, and it's not a system. So there's no way in which anyone can be an expert at navigating this, even when they're at the top of their game, even if they're not going through grief or they're totally sleep deprived as a resident or a fellow, um, let alone when you are in that situation and you're trying to, you've had a bunch of like long call days in a row and you just need a physical kind of thing, or you're sick and you need to see a doctor out of state to a place you just moved to 6 months ago at an institution you barely know. It's really, really difficult. So yeah, I don't have any kind of silver bullet answer for how to navigate it. It's for just kind of a lot of trial and error. And getting it wrong sometimes and getting things rejected sometimes, and then I guess eventually doing the right thing and getting it right.
Yeah, but it's helpful to have ideas of different things to try and to also know that somebody was able to make some version of it work. Like, I think that those things would have brought me comfort, like as a trainee. Um, by the way, the person who said that quote, like, I love that. They left no crumbs. That's great. I got to look that up.
I'll
I
have to
feel
look it up
like,
too.
yeah, I have a quote marked here in my notes, literally as I was like preparing for today's conversation, and I love this is like so 2025. It what I'm going to quote now is a tweet from Cat Doc, and I don't think it's a vet account or anything. It's just like a cat, with a stethoscope. So welcome to the future. But the quote is from this tweet. Medicine is so weird in that in order to be considered good at it, you're expected to go against every piece of self-care advice that we give our patients. Because, if a patient said to me, like, and I was in clinic all day, if a patient had said to me, like, I don't have any doctors, I don't have a physician team, once a year I get strep throat and I go to a walk-in, I'd be like, we gotta clean this up a little bit. Like, so you have no content, you have no one who um, really like follows you and things like that. Or like, let me give another example, which is that if somebody told me I'm really, really struggling, like I'm struggling, I don't feel like I have anyone to talk to, I'm going through a difficult period, and then I say, okay, have you talked to a therapist? And they're like, no, I don't have time for therapy. The physician in this conversation, I'd be like, okay, this person's not doing very well. Now we got to try and get them hooked up. But when we are the patients, it's crazy because it's not just, it's that these things are inversely related. It's not even just that, like, oh, it so happens that there's an association where like physicians are not good at being patients. It's that literally, I think even in this modern society, there's like this stereotype of if someone was describing a doctor and they're like, this doctor takes pretty good care of themselves. When they move to a new city for a new chapter of their career, they go ahead and they get set up with a primary, you know, with an ENT because they had an ENT in their old town. Like, they do a good job. They set up therapy. Like, their old therapist doesn't see people out of state. They take the time to find someone who takes their insurance, who they got on with, to be their therapist. It's like if somebody even described like that student or that resident or that attending, I know a lot of people would side eye that. They'd be like, oh, they think they're too good to just eat their problems and see patients like the rest of us. Like, I mean, do you still sense any of that at all? I know it's very alive and well, and not just as a surgeon.
Yeah, definitely. It's you mentioned physicians are often not great patients, and I think it's not because we don't want to be. It's a lot of times we physically can't. I mean, the average resident and attending physician will work maybe double the typical 40-hour work week, and when you're working 6 a.m. to 6 p.m. or something like that, 6 days a week, there's really no mechanism for you to do all the things to take care of yourself and be well. You can't expect yourself to get enough sleep and to eat 3 square meals a day and get plenty of fiber and vitamins and minerals and go for jogs and do all of these things to care for yourself. But you're right, if someone does do those things and like even verbally says, I want to prioritize my wellness, that can be like a little strange to hear from a resident. Like, because I
Some
think the
people would
culture,
regard them as fighting words.
you're supposed to, air quotes, you're supposed to just kind of grind through it, like suck it up. Like, it's only 4 years or however long whatever residency you're in is. You're supposed to just kind of do it. And if you don't get enough sleep or don't eat enough or gain some weight because you didn't exercise or didn't see a doctor once during your whole course of training, like, good. That's what we all went through, right? So it's imagining some of the older docs or some of the attendings, like we all did that, right? It's almost like this like really unhealthy rite of passage that you're not supposed to be a human being when you're in training. So yeah, we totally see it.
I think that, but that's one of the things that, I do really appreciate about you. And of course we can go deeper into even like lifestyle choices and thoughtful career choices. And, like we talked about, even the advocacy and things like that another day. But I want to highlight for everyone, they, especially the next generation, right? Like, so younger people who maybe they're earlier on in their careers and they're looking down the barrel of a decade of really becoming a physician or becoming a surgeon. It's like I do truly think that you did a lot of things right. And I wish that I had role models like you when I was younger, when I was very, very impressionable. And I did think that not seeing a doctor and working as hard as you can gets you some kind of like maybe special award. I don't know. Now I'm like, well, what the heck? Where's like the special award for that I was promised? And I've been attending for a couple years now, and like that award is fake, but a lot of us fall for it when we're 20. I want to just share, like, so in contrast, I I had just turned 21 when I lost my dad, and it was unexpected. It was a sudden cardiac event. So I was in my gap year. I was in St. Louis at the time. I was living in a little studio in Central West End. I was doing full-time ENT outcomes research. That was my one gap year pre-medical school. So it was October and I got a phone call, and it was, when my mom had found my dad at home and called 911. So it was actually a policeman on the phone who called me and gave me the news. And he was like, "Sorry, I don't know you. Sorry to deliver this news to you." And I was like, "Okay, you can of course please tell my mom, like, I'll be on the first train home." So that happened to me. I was 21. My dad was only 60. So it was pretty sudden. And what I want to just say, because it's pertinent to this conversation, is that number one, I went home to do a little bit of clerical stuff, organize the funeral, and then was back at work, doing my full time like research job. I never took time other than like, I mean, maybe like 2 to 3 days, maybe to accommodate, the funeral on a weekend. I did not, I proceeded to not go to therapy and never went to therapy until the age of 28 when I, 29, when I was really struggling as a resident. Like, funny how that happens. I don't think that you maybe like get off scot free. I just really, really like pushed through. I really, to a fault, just gritted my teeth and pushed through. Still ended up in therapy and now am, like an avid believer in therapy. But it's also probably not a coincidence that, to remind people of like my timeline, then when I was 32 last year, I ended up in the emergency room. This kind of nicely links together the lack of like primary care and medical care too. Like this picture of, well, then 6 years of a stomach pain led me to the emergency room, where I then got set up with a GI doctor. And, on scope, they found over 20 peptic and duodenal ulcers, and like many were bleeding. So the severe pain I was imagining that was like taking my breath away, it was real. And um it's so funny because somebody asked me recently, they were like, "How was your H. pylori?" Like, I remember the news, I remember the ulcers. Did you get the H. pylori sorted? Which totally get it. And I'm half Asian, so higher rates of H. pylori, plus that many, like, so severe, that burden of bleeding ulcers. Guess what? H. pylori was all negative. That is really, and of course, some of my general surgery friends were like, I have only seen that in like burn patients, like a burn patient level stress. And I, that, that sounds believable to me, because like the body keeps a score. And I say all this because I really, cannot overemphasize to people, especially young, impressionable people, you do not want to be that guy. You don't want to be the guy where like your stomach looks like a burn patient's stomach. And you don't have any like medical care and you haven't received like mental health care, despite the fact that, all sorts of things will come up while we're on our path to training and becoming
Thank you
where
for
we're at.
thank you for sharing that. That's really sad about your dad as well. That's not an easy story. That wasn't something easy to go through, certainly. But I totally agree. I mean, I'm of the mindset that really anyone who's alive on Earth could benefit from a therapist. I think it's certainly like criminally underutilized and unavailable to people during training, but really the same applies, I think, to everybody. To have a space where you can, share your feelings, develop maybe positive coping mechanisms, just get a new perspective on things and have it be a safe space is invaluable. And I think if I were to put a crown on myself and make myself ruler of the world, I would put every medical trainee and healthcare professional trainee and professional in therapy. I'd have it be an opt-out thing, because that's how helpful I think it could be if it were more embedded.
And I love that. I totally agree with you. And I will say that at the ACGME Physician Wellbeing meeting just this past fall in Chicago, there were some really like novel, brilliant, like DIO presentations, which DIO, man, do you know what it stands for? It's like
Director of Institutional Organization, something like that.
Yeah, it's like a fancy residency.
The person who kind of oversees.
Designated institutional official. I gotcha.
Okay,
So,
it's
it's separate from like, no, it was a good guess. I mean, DIO, it doesn't really describe the role, I think, but like there's program directors. We've talked about that. There's a chair of your department. There can be an assistant program director, but this designated institutional official, the DIO, they help like the institution from the ACGME, like graduate medical education and kind of like rule enforcement procedures front. Some DIOs are doing that at their programs, the opt-out mental health visits. And not only that, but like I've even heard of primary care where like you get your match email. Awesome. You're set up at this institution. And then you get a welcome email. It's from the DIO. It says, we have like this, and this option for you to get set up with a primary care doctor at our institution. That is incredible.
That's the dream. I mean, because you just think of the percentages of people we touched on a little earlier, the percentages of people who are going to, medical school or residency or fellowship and doing it completely out of the state, out of their home state or across the country at a brand new institution to navigate starting your training and embedding yourself into the healthcare system with a doctor and maybe a mental health person is impossible. So to provide that resource, I think just it breaks down so many of those barriers. It's great to hear.
Exactly. And kind of normalizes it. Because in that scenario, if a first year resident says to their senior, whoever, they're signing out to, they're like, hey, on Tuesday at 11 a.m., I do have to go to my doctor's appointment. Well, guess what? All of your first years have that. So it does take a little bit of maybe the awkwardness of it out. If somebody does not feel comfortable asking for the time, making it built in. I think that's really wonderful. And hopefully we continue to see that at like more and more institutions, because obviously pretty limited right now, places that have that resource.
You're totally right. I've seen residents, as faculty member I work with, maybe I should have said our program has 6 residents per year. So I work alongside over a dozen residents all the time. And I've seen residents very kind of sheepishly ask for an hour to have therapy somewhere. Like, where can I fit it in? I'll work with my therapist, find the best time. And they're coming to us as faculty or program administrators and almost like ashamedly asking. And it should not be that way.
No, I agree with you. It's brave to ask it, and it's very smart and very brave to know that it's important and like to put time into that. Because again, I'm still waiting. I mean, maybe there is an award for like most ulcers in a doctor in a year, and like I get that award. Like maybe it's coming in the mail. It got lost in the mail, right?
Yeah, COVID swept it up, and it's somewhere in the Pacific Ocean or something.
Well, I think that we touched on so much today, and I'm so grateful to you for coming on to the podcast, for coming on to share your story and, your vulnerability and everything that you've been through. I want to leave the floor open to you for, really any words of wisdom, the meaning that you've taken from everything that you've been through, or any advice to leave us with.
That's really nice. Thank you. I would say if you're a medical student, resident, fellow, as well as any of our other healthcare professional colleagues, if you're in school for dentistry or if you're in PA school, nursing school, MA school, RN school, anything, our job is to take care of patients. And I think I've mentioned to you before, Francis May, that to do that our best, we have to be our best. So if you're in a position in any kind of career where your job is to provide healthcare to others, you owe it to them as well as yourself to be the best version of you that you can be. And that often involves participating in things that are wellness based. So that's having a doctor, that's maybe having a therapist, that's, doing your best to normalize your sleep schedule, your diet, your exercise routine. I hope one day we live in a world where nobody is hesitating or afraid to ask for those things for themselves. And I hope one day we live in a world where training programs and hospitals and clinics recognize that we're not robots doing assembly line work. We're human beings doing a very social job. So we need to be our best version. So as much as you're able to carve that out for yourself and still be able to do your job as you want to do it and do as much of it as you want to do, I will be an advocate for you. I hope you can be an advocate for yourself. And I like we're talking about, I hope things change for the better in that direction as time goes on.
Yeah, very well said. I think, you may be listening and kind of thinking like, yeah, I've heard this before. There are people who say, hey, like physicians need to be well to take care of other people, but there's not a lot of like walking the walk behind it. But, Dominick, I really do think that you walk the walk, and that is a good example for us because like we are looking at a pretty self-actualized, well-adjusted doctor. And for a long time, you could not convince me that existed. So, it still couldn't be me. It's still not me quite yet. But like, I think that this is the type of, like great role model that we have out there to take seriously. Like, I think that's such a beautiful parting message.
Thank you. I appreciate you saying that.
Where can our listeners find and connect with you online?
Yes. So maybe this is a reason why I've been pretty well recently. I'm not on really any social media. I do have an email address that maybe can be left somewhere, and I'm open to people reaching out for any conversation that would be helpful to them. And I have a LinkedIn page, just my first and last name, Dominick DeFelice. You see a picture of my face. Feel free to message me on there as well. And about anything, truly, I truly do want to make myself available, for anyone who is struggling to articulate some of the things I've talked about, or struggling with navigation of things related to things we've talked about, as well as sports medicine, healthcare advocacy. If there's a professional interest, I'm happy. So email or LinkedIn.
Thank you so much. Follow me on Instagram at @francismay.md and @rethinkingresidency. Visit my website, rethinkingresidency.com, to learn more about resident physician stories and ways that residents can most effectively navigate the game of residency. As always, we appreciate your support of this podcast. Thank you for tuning in to this episode of Promising Young Surgeon. If you enjoyed the episode, please subscribe, rate, and leave us a review. Until next time, remember to take care of yourselves and each other. If you'd like to submit any questions for future episodes, email me at pys@heyinfluent.com.